Let's take a look at a sideline technique called the hip percussion technique to move the hip. It's a little bit different concept than the traditional osteokinematic or arthrokinematic mobilization. What I'm going to do to the hip, again, I'll show you the skeleton first and then the model, is I'm going to come on the back of the greater trochanter, posterior aspect of the greater trochanter, right? And I'm going to give her a little bit of an anterior push. It's not really a glide because I'm not at the ball, I'm at the trochanter. So I'm going to push her a little bit anteriorly, which, if you can see, kind of pushes the hip into some internal rotation a tiny bit. If I push the trochanter anteriorly, it's going to be internal rotation. So I'm going to give her a little bit of an anterior push at her trochanter, make sure she tolerates that, ask her if it's okay if I kind of hit my own hand, and then I just do the quick impulse in that same direction, with the idea being I'm going to give a quick blow to the back of the trochanter, potentially moving her into a tiny bit of internal rotation, but this is not an anterior-posterior glide of the femoral head. This is just a quick internal rotation to try to improve internal rotation range of motion. Right? So the idea behind it, as far as why it's effective, is the quick part of the percussion, not an arthrokinematic anterior-posterior glide. All right? So I'll show you what that looks like. On the skeleton again, I'm going to come in the back of the trochanter. I like to make sure that's tolerated. Then I like to hit my own hand from a target practice standpoint. Okay. So I'm going to put our model's leg in a little bit more. She's pretty mobile. I'm going to put her in a little bit more adduction from there. You okay with that? Mm-hmm. Come on the back of the trochanter here, right? If I kind of adjust her sweats a little bit, you can see hopefully that if I spin her trochanter that way, that's going to be a little bit of internal rotation for the hip itself. So there's the back of her trochanter. Tolerable?
Yes.
Okay, I'll do some mini practice percussive techniques here. I'm going to hit my own hand. Is that okay?
Yes.
All right, so then I keep that push, and then I'm going to hit the back of my hand, and then I like to do the percussion technique where I kind of do this glancing blow. So I hit and skirt off. I don't just do the pulmonary percussion in this case where I cup my hand. I'm going to hit and glance off. Okay, so there's my push, quite a bit of force going through with my whole trunk into here, and then I just whack it forward like so, and then you can reassess your motion. Again, typically on hips, it's this internal rotation that we're trying to restore. And again, the single percussive technique should be a great improvement in internal rotation range of motion. Thank you.